Hello viewers, let us discuss today the topic Development and Social Welfare in India through a study of the health policies in the country. We already know that the Constitution of India provides for detailed measures to bring about all-round development and welfare of the population. We also know that Part 4 of the Indian Constitution provides for directive principles of state policy, which provides for a plethora of directives and guidelines to be pursued by the state in order to fulfill the health-related requirements of the population. In fact, we already know that improvement in health and nutritional status of the population has been one of the major thrust areas of development and social welfare policies in the country. In this lecture, we will try to understand the organization of healthcare governance in the country as well as analyze the major national health policies pursued by the Indian state from time to time. This module is organized in the following ways. First, we'll try to understand healthcare structure and governance in the country. Then we'll try to understand and examine the three major national health policies implemented by the government, and finally we'll summarize with the effectiveness of these policies. Let us now try to understand the organization of healthcare governance in the country. We already know that India has adopted a federal structure of governance with clearly defined jurisdiction of the central and the state governments. The Indian Constitution outlines public health, sanitation, hospitals and dispensaries as state subject, while population control and family planning, adulteration of foodstuff, control of infectious and contagious diseases across state boundaries and issues governing medical profession are placed under the concurrent list where both the center and the state have common jurisdiction. Hospitals attached to port facilities for quarantine or seamen's hospitals are exclusively under the jurisdiction of the central government. Policy formulation and regulation on health insurance is largely under the control of the central government. Social health insurance, however, is in concurrent list, paving the way for state-level policy formulation. Given the constitutional division of responsibilities of health care, legislation vision, financing and delivery of health services have largely been the preserve of the different state governments, albeit with periodic interventions from the central government. Funding from state governments account for 2/3 of the public health expenditure, the rest coming from central government contributions. Central government's interventions have largely been in the form of vertical programs of national importance. This means that the central government has largely focused itself on specific disease prevention and eradication, such as family planning, polio eradication, malaria eradication, tuberculosis, HIV/AIDS and reproduction, maternal, newborn and adolescent health. These vertical programs were funded by the central government, but the responsibility of implementation rested solely with the states. Thus, we find that the real responsibility of organizing and implementing healthcare services is with the state governments. Let us now try to understand and analyze the major healthcare policies in the country. So far, India has embarked and implemented 3 national health policies. The first one was in the year 1983, then the second one in the year 2002, and the third one in 2017. But before we move on with the analysis of the 3 national health policies, it is pertinent to understand the history of evolution of healthcare in the country. Prior to attaining independence, the responsibility of legislation and implementation of public health services was allocated to states by the Montague-Chelmsford Reforms and the Government of India Act 1935. In colonial India, most of the modern health services was provided through hospitals, and these hospitals were located mainly in the three presidency towns of Calcutta, Bombay, and Madras. These hospitals and dispensaries mainly catered to the British officials and their families, the army and the troops, as well as the native princes and some local elites. The common people or the poor Indians were completely barred from accessing health care from these British-run hospitals and dispensaries. The commoners were largely dependent on the traditional system of medicine, mostly Ayurveda and Unani, which was available by local healthcare providers. Now, in order to create a comprehensive healthcare policy in 1943, a committee was set up known as the Health Planning and Development Committee under Sir Joseph Bhore for remodeling health services in India. The report, popularly known as the Bhore Committee report, was submitted in 1946, which was largely remodeled along the lines of the Britain's National Health Service Scheme. Sir Joseph Bhore made recommendations that formed the basis for organization of basic health services in India. He made a case for social orientation of medical practice coupled with a high level of public participation. Taking a clue from the Bhore Committee report, a beginning was made in the year 1952 to set up primary healthcare centers to provide for integrated, promotive, preventive, curative and rehabilitative services for the entire rural population in the country. Let us now try to understand the basic principles of the first National Health Policy of 1983. Now, we need to understand that the 1983 health policy was monitored and was on the basis of certain global declaration. That global declaration was the Alma-Ata Declaration of 1978, which propounded that the concept of health for all should be there around the world by the year 2000. This particular declaration was signed by 134 countries, including India. The declaration advocated the provision of first contact services and basic medical care with the framework of an integrated health services. The declaration affirmed that it is the responsibility of the state to provide for comprehensive primary health care to the entire population. This led to the formulation of India's first national health policy in the year 1983. Now, before 1983, we had just state level programs and policies, but there was no major uniform national level policy which could be uniformly applied across all states. Let us now move on to the key features of the 1983 National Health Policy. The first thing that it focused was the need for providing primary health care with special focus on preventive, promotive and curative health care. The second thing that it focused was population stabilization. It was believed that overpopulation led to multiple problems and hence small family norms were encouraged. The third important aspect focused by this policy was medical and health education. It focused on the nature of medical education, training and appropriate orientation towards community health of all categories of medical and health personnel. And the capacity to work as an integrated team. So the focus was not just clearly providing certain forms of healthcare services, but training of manpower to provide for healthcare services in the rural and remote areas of the country. In the National Health Policy of 2002, which was an improvement upon the previous policy, instead of focusing on primary health care, the 2002 policy focused on certain year-specific goals. What is important to understand that 2002 policy did not bring about a major overhaul in disease prevention, but it created certain landmark goals for the central and the state government to ensure that some diseases are completely wiped out from the country. Let us take a snapshot into some of the goals that was highlighted in the 2002 National Health Policy. Eradicate polio by the year 2005. Eradicate and eliminate leprosy also by the year 2005. Eliminate Kala Azar by the year 2010. Eliminate lymphatic filariasis by 2015. Achieve zero-level growth of HIV/AIDS by 2007. Reduce mortality by 50% on account of tuberculosis by 2010. Malaria, other vector and waterborne diseases should also be reduced. And finally, reduce prevalence of blindness to 0.5% by 2010. Now, how do we address these goals? How do we implement these goals? So, the 2002 policy also laid out a network of implementation scheme in order to address and reach these goals. The first important aspect that was emphasized was on the role of the private sector. The government accepted the fact that the private sector has an important role to play in elimination of these diseases. It emphasized on the role of not just private sector, but also the secondary and tertiary healthcare sector. Private health insurance packages were proposed to be encouraged. Another very important point that was addressed was the use of telemedicine for enhancing the capacity of professionals. Telemedicine has become quite popular in recent times, but we need to appreciate the 2002 National Health Policy for providing a network and a roadmap to avail the same. The second scheme that was emphasized upon was extending public health services, where the role and contribution of private health practitioners was also encouraged. The state governments may enforce a mandatory 2-year rural posting before awarding the graduate degree of MBBS to medical students. An effort to Indian system of medicine was also attempted through the NHP 2002. Thus, the purpose of NHP 2002 was to streamline medical services and ensure that medical professionals are spread out through the length and breadth of the country. The third thing that this policy focused on, a medical code of ethics. The policy calls for adoption of a contemporary code of ethics by the Medical Council of India so that the patients are not driven by profit-driven medical treatment. Nursing personnel was also emphasized upon, and it was believed that the ratio of nurses to doctors and beds should be proportional. Use of generic drugs and vaccines. This is a very landmark decision taken in 2002. The policy emphasized the production of low-cost and high-quality indigenously manufactured generic drug and vaccines so that we are not overtly dependent upon costly, expensive imported drugs and vaccines. The NHP 2002 also focused on urban health and the setting up of an organized private urban system in slum localities. It also focused on the role of the private as well as the public sector in addressing urban health problems. Along with that, the policy also focused on women's health. This was the first time that women's health issues were taken up in any national health policy, and it was believed that women's health issues and women's nutritional program should be given prior importance. Let us now move on to the last national health policy, which was implemented in the year 2017. NHP 2017 identified 4 contextual changes that had happened since the formulation and implementation of National Health Policy 2002. The 4 contextual changes were the growing burden of non-communicable diseases and some infectious diseases. So the type of diseases have changed since the days of 2002 and 2017. The second change was the emergence of a very strong private healthcare industry. Third, the incidence of catastrophic expenditure due to healthcare cost. Healthcare and health services was becoming highly expensive and at certain times beyond the ability of the common man. Fourthly, rising economic growth enables enhanced fiscal capacity of the patients. Not only was there a rising expenditure on healthcare cost, but an enhanced capability on the part of the patients to provide for such enhanced cost. The primary objective of the National Health Policy 2017 was completely different from all previous policies. The objective was to strengthen the trust of the common man in the public healthcare system. One thing that was noticed was that the common people were more encouraged to go to private hospitals and dispensaries rather than go to government medical institutions. Therefore, 2017 policy aimed at creating a sense of trust among the common man in the public healthcare system. The purpose was to make it patient-centric, efficient, effective and affordable, with a comprehensive package of services and products that meet immediate healthcare needs of the needy people. Increase of health expenditure of the government from the present 1.15% to 2.5% of the GDP by the year 2025. Increase of life expectancy from currently 67.5 years to 70 years by the year 2025. Now, in order to address this vision, NHP 2017 provided for a series of objectives that have to be effectively implemented. The first objective that it focused was an assurance-based approach. Advocates progressively focus on incremental assurance-based approach with focus on preventive and promotive healthcare. The purpose and the objective is to gain the trust of the common man. The second objective was health card linked to health facilities. Recommends linking of the health card to primary care facility for a defined package of services anywhere in the country. The ultimate objective is that all the citizens of the country will have one health card which can be easily used in all healthcare services across the country, which will also have data of the patient's medical history, thus making healthcare services efficient, effective and people-friendly. The third thing that was focused was the patient-centric approach. The 2017 policy recommends setting up of separate empowered medical tribunals for speedy resolution to address disputes, complaints regarding the standard of care, regarding medical negligence, prices of services, as well as ensuring that there is a standard regulatory framework for laboratories and imaging centers as well as specialized agencies. Recommendation was also there to create a uniform pricing system for all diagnostic services. Micronutrient deficiency. Focus on reducing micronutrient malnourishment and systematic approach to address heterogeneity in micronutrient adequacy across regions. It has been clearly stated that most of the people of the country suffer from certain levels of nutrient deficiencies, especially women and children. 2017 policy focusing on addressing these micronutrient deficiencies. Next important aspect focused on is the quality of healthcare, which has come under severe criticism from time to time. Public hospitals and facilities would undergo periodic measurement and certification of the level of quality. Focus should be on providing clean, hygienic conditions within the public healthcare institutions. Make in India initiative. A lot of initiative and incentive should be provided for local manufacturing to provide customized indigenous products both in terms of generic drugs as well as vaccines. Application of digital health. Deployment of digital tools for improving efficiency and outcome of the healthcare system. And finally, emphasis on improvement and involvement of the private healthcare system. There is a critical role of the private healthcare providers to fill in the gap where the public healthcare system misses out. Comprehensive primary healthcare. This policy emphasizes on the creation of health and wellness centers for overall mental well-being of the people. Mainstreaming of Ayush. Focus on mainstreaming and integration of Ayush into healthcare delivery through co-allocation, cross-referrals, and integration with primary healthcare protocols. Thus, we find that the three national health policies presented the contextual situation in the health policy scenario and established certain goals to create certain health indicators to be pursued by the government from time to time. Now let us try to understand that are these national health policies adequate? It has been observed that only creating and promulgating national health policies are not adequate by itself. As a result, the government has come out with the National Health Mission in order to provide for separate rural and urban health mission. Let us try to understand a little about the National Health Mission adopted by the country in the year 2005. The National Health Mission is a comprehensive policy in order to provide efficient, effective, and affordable health care to all. The National Health Mission is divided into two parts. The main component of National Health Mission comprises of a National Rural Health Mission as well as a National Urban Health Mission. The objective of National Health Mission is improvement and strengthening of healthcare in both rural as well as urban areas, reproductive, maternal, neonatal, child and adolescent health, and thirdly, focus on communicable and non-communicable diseases. Let us try to learn about the National Rural and Urban Health Mission. The National Rural Health Mission was launched in the year 2005 throughout the country for providing better rural health services. The thrust of the mission is to establish a fully functional, community-owned, decentralized healthcare delivery system with intersectoral convergence at all levels. This means that National Rural Health Mission seeks to give responsibility to the local communities in providing effective healthcare services. Another important aspect of National Rural Healthcare is strengthening the local governing bodies and giving them enhanced responsibility in providing rural healthcare services. National Urban Health Mission is designed to provide integrative preventive healthcare to urban areas, especially the slum areas. The National Urban Health Mission covers all state hospitals, district headquarters, and cities and towns having a population more than 50,000. Areas having a population less than 50,000 will automatically be covered by the National Rural Health Mission. Thus, the National Urban and the National Rural Health Mission seeks to provide integrative healthcare services by involving local communities and making way for decentralized planning at all levels. Let us now summarize what we have studied so far. The various health policies that have been designed have tried to provide an integrative preventive healthcare to the different stakeholders in the country. These policies seek to understand the changing nature of diseases, the shifting of disease burden, and utilize the limited resources available in the country. Healthcare services are expensive, but the task of the different health policies have been to provide quality, affordable healthcare to all segments of the population. The policies aim to ensure medical health becomes accessible and affordable. At the same time, it seeks to ensure that national medical health care can reach the level of a systematic, efficient system of providing health services not only in the private healthcare sector but also at the public level. Thus, the core idea behind these policies is to provide for health and well-being of the entire population of the country. Thank you.